Namaskar, friends. Today, in the group, one person has asked a couple of questions. We would like to look at that questions. What they say, see, why do we skip the breakfast? See, by skipping the breakfast, we'll feel hungry. How can we do the job? Generally, most of the time we learn breakfast is the important meal of the day. We must eat like breakfast like a king and lunch little less and probably the dinner as a pauper. That's how it is said. That's one question he asked. And the second question is that he says, see, every day we must eat 2,500 calories. Why should we eat in two times? Because eating twice will cause a large amount of sugar and insulin. Instead of it, doctors say 3 to 4 times you must eat. So, what should we do? So, this is the question they have asked. So, we look at it today, friends, how it is. Yeah, see, friends, every human being is unique. Just remember this point. So, you have to choose your diet accordingly. See, when you go for buying a t shirt in a big ready-made shop, there are four different types of t-shirts are there. One is small size, another is medium, another is large, another would be extra large. So 80% of the people will be able to fit into these four ranges, but 20% may not be able to find these four sizes suitable to them. So what they do, they have to go for tailor-made dress. Similarly, every human is different. How are they different? See, first is the age, and they're male or female, what sort of genes they have, what sort of BMI they have. BMI means what is their height to weight ratio, and height to waist ratio, number of medicines, comorbid. Suppose somebody is already having a lot of health problems and they're using some medication, metabolic health, gut health, how is their digestive system, are they able to go to the stools every day or not, what sort of acidity levels they have, what sort of insulin resistance they have. Anything above 1.5 is insulin resistance. Insulin resistance means they may have overweight and blood pressure, cardiovascular diseases, thyroid, blood pressure, everything like that. So what is their HbA1c level? If it is 5.6 means they're already pre-diabetic. Triglycerides to HDL ratio, if it is high, they have heart problem. D vitamin, if it is low, there are issues. B12 below 300 is an issue. How they manage their mind, how they manage their stress, how is the sleeping pattern, what sort of exercise they're doing, how active they are, what sort of work they do, whether they have 8 hours physical work or the office work, what sort of food habits they have. Some of the people have vegetarians, non-vegetarian, some of them toxic habits. What are the toxic habits? Having alcohol, drugs, and probably coffee, tea, cool drinks, and all, sir. What sort of environment are they living in? A very polluted environment, or how is their economic conditions? Of course, prarabdha karma. I mentioned this because despite all this, or in spite of all that, one person can be healthy or unhealthy. So that's it's a very small portion of it, but it is a very important parameter. Now look at, friend, hydration, drinking 3 to 4 liters water, elimination 2 bowel movements every day, avoidance or reduction of processed, refined, high carb foods like sugar, bakery, stimulants like alcohol, coffee, tea, cool drinks. These are absolutely essential for any diet you follow. Exercise you have to do, mind management so that you are stress free and you are having 7 hours sleep at night. These are the basics one has to follow, irrespective of any diet plans. I have seen many diets, they don't focus on the subjects, they take it for granted. No, they are very essentials. Now let's look at it, friend. Changes in type of food. What are type of foods are available? SAD means Standard American Diet. There is a diet plan given by the government of America for its citizens. Low carb, high fat, and the keto diet, and plant-based whole food. And there are so many other diet plans also, Dash diet, and then carnivore diet, all those things. So that means different types of foods are suggested. Then another type is frequency of eating. Somebody suggests you take 6 small meals a day. Somebody says 3 meals a day. This is a very common thing. Everybody does free breakfast, lunch, dinner. And somebody suggests eat only 2 meals when hungry. And somebody even suggests 1 meal a day. Another thing is third thing is fasting or eating window. It's intermediate fasting. They say okay, 16 hours is the fasting window, 8 hours is the eating window. That means in 8 hours you can eat whatever you want, whenever you want, whatever number of times you want, that you can do that. That's the approach. 12 12 means 12 hours fasting, 12 hours feasting, well, eating. calories. Somebody says, oh, you must eat 2,500 calories every day because that is required. Somebody says, no, no, 1,500 calorie would be better. So that is the quantity of food can make a huge defect, impact on the on an individual. It could be good or bad. So these are the changes. Anybody, these various diets are available. You can choose out of that. Now, hence, certain diet plans give good results to a few and not so good results to others. You must have observed that one diet could be giving a good result to one person, other may not be. Most of the diets help in losing weight. Remember that, friends. All these diets are excellent diets, and they give you. They're primarily to improve your, any weight reduction, overall health, and all that. So, what needs to be done? Underweight people, teenage people, aged people, people with chronic lifestyle diseases like whatever they have, high sugar, the high blood pressure, things like it. They're under medication, suppose various medication. They must not jump to any diet, friend. They must consult their doctor before adopting changes in diet plans. Next, whenever one changes food habits, suppose you made some changes, so you must listen to your body, track your 12 health parameters. We have discussed that about, and make appropriate timely changes. If you don't do that, it will be too late for you to make changes. Because there are people who are underweight people, they jump onto this bandwagon and they lose further weight. I come across a person who was around only 48 kg weight, and she had attempted for this particular diet, one particular diet, to get rid of her, constipation problem. But end of the day, she lost 10 kg. She became 38 kg weight at age of, she's about 30-year-old lady. So one has to be very careful, friends. Now the question is, we just ask this question. So should we discontinue the breakfast? So how do we go hungry and do the job? See, friends, what I am suggesting. So what is our diet plan? We are suggesting eat twice in a day when hungry. If you're hungry, eat in the morning itself. There's no hurry, no harm. Eat only when you're hungry. You should not eat food when you're not hungry. And eating twice in a day is quite sufficient for adults who are already grown up. There's no further growth. After age 20, there's no further growth. We are neither going height, only we are going the front side only. So weight only will going to improve. So two times eating is sufficient. Now the question is when to eat. I'm not suggesting, see, this breakfast, lunch, dinner is a mindset, friend. See, moment you say whether you are hungry or not, oh, I have to have the breakfast, I have to have the lunch. Don't get into that. Your criteria should be hunger. If you are hungry, you should do. It does not mean one day you follow one time, another day another follow time. So find depending on your workload. Suppose you're an office goer, find a way which is the convenient to you. Can you take a break at 12 o'clock when you're hungry for lunch? If you cannot take, okay, you're going to office at 8 o'clock and up to 1 o'clock, you are not going to get any break. So decide how to go about it is your choice. I'm only telling you, have full meals to your satisfaction, no restriction of the quantity, two times in a day. So that's what it is, friend. Now, the second question he was asking about calories. Why we should take all the calories in two meals? See, friends, what happens? It all again depends. Some people, suppose a person is already diabetic, he's taking insulin. Doctor suggests him take small meal six times. So they must follow that. By and large, all general people can shift their, all calories in two. Let's not get into calorie count and all. That does not work. So you have your two meals. Now the question is what type of food you should have. It again depends, friend. A person is highly diabetic and high sugar levels is there. So he must go for no carbohydrate foods, very less carbohydrate foods, more fat and all that. And somebody is having a different problem. So accordingly he must choose his diet. Now look at these diet plans, friends. As we discussed, Dr. Mantina Sachin Raju, he has an excellent diet plan. And then VRK diet. This is basically more of a fat diet. It's a radical diet with high fat and all that. It's extremely good for people who are diabetic, high diabetic, HbA1c 12, 13, and weight is about 100, 120 kg. They get an excellent results with this diet. And then Dr. Jagannath Dikshit diet plan. It's another amazing thing. Very, very simple. It is massively people are following it. Two meal system. This is also another wonderful thing. LMK, Lalit Kapoor diet, plant based whole food. Excellent results people will get. And then wholesome health, Colonel Gautam Guha. He also talks about very low carb diet with a lot of supplements and all that. Common man diet, Chandramouli sir is a science teacher, excellent diet plan. New diet system, this BB Chauhan and Akhilesh Maharaj, Dr. Jarna Patel, their method is extremely good for people with autoimmune diseases and all that. So you all know the intermittent fasting, 16 hours fasting, 8 hours eating, YouTube videos are there, plenty of the people. Dr. Sten Ekberg, you can listen to his talks and all. What is that wellness secrets? I have spent almost in the last 8 years more than 6,000 hours. I try to understand it. I try and take the best of everything, and I have experimented on myself and I experimented on many people. What are we doing, friend? What is our approach? See, we are talking about 3 to 4 liters water every day one must consume, two bowel movements, 45 minutes brisk walk, 7 hours sleep at night, eat only twice when hungry, preferably one time take natural food, fasting once in 15 days, and 16 hours fasting every day, stress management, and checking your health parameters. 8 health parameters. What are they? Weight, which should be as per the height, waist size, your fasting sugar, fasting insulin, HbA1c. D vitamin level should be absolutely good enough, and then B12 vitamin. With this, insulin can be checked. Your insulin sensitivity should be below 1.5. You should not have insulin resistance above 1.5, friends. With these approaches, and I'm sure this will clarify your doubts. If any more doubts are there, people are welcome to speak to us. And this is a transformative group, friend, Wellness Secrets friends. These are the few people who have benefited. My name is Gangeshwar Rao. I'm not a doctor. So track these 12 parameters. We discussed this. You should not take any medication. Your weight should be as per your height. Waist size should be half of your height in inches. Blood pressure should be below 120 by 80. Fasting sugar is preferably 99 milligram per deciliter below. Fasting insulin 3 to 5. A1C 5.6% below. Lipid profile, triglycerides to HDL ratio should be between 1 and 1.5. High sensitive C-active reactive C-reactive protein is inflammation marker. It should be below 1. D vitamin, the best is 60 to 80. B12 would be 600 to 800. HOMA insulin resistance is fasting insulin multiplied by fasting sugar divided by 405. It should be below 1.5, friends. Friends, I'm not a doctor. If anybody have health issues, they must consult their doctor. Please take it forward, share to your friends, and invest time in learning more. Knowledge and discipline are the gateways to your health, friends. Thank you very much for listening.